embryo and then later the fetus, they're connected to the placenta by the umbilical cord. And the placenta allows nutrients and oxygen to pass from the mother to the fetus. Before I talk about the fetal stage, I want to point out what some of you might be thinking, and you might have thought about the stages of prenatal development and how they're normally divided into trimesters, and that is absolutely true. They are divided into trimesters, but we can also look at prenatal development in terms of these different stages, and these different stages have some very unique characteristics and features related to human development. So in the fetal stage, this is where we have we're going from the 9th week of pregnancy around that time until the birth of the child. And all the major organ systems, including the fingers and the toes, they're formed by about the 12th week of prenatal development. And this roughly corresponds to the end of that first trimester. So they continue to develop, though, throughout the course of pregnancy. The fetus is increasing more than 30-fold in weight during the second trimester of pregnancy, from about 1 ounce to about 2 pounds. And it grows from about 4 inches in length to 14 inches. And typically the mother is going to feel the first fetal movements around the middle of the 4th month. And by the end of the second trimester, the fetus approaches what is known as the age of viability. And this is the point at which it becomes capable of sustaining life on its own. Now, this does not mean that all babies born at 24 weeks, which is the age of viability, are going to be able to sustain life on their own, very unfortunately. I don't think there are words to describe how very, very unfortunate and sad that is. But the chance is, is still pretty low, about 50% chance of survival at this point. And children who are born at this very early stage of development are at a significant risk for physical problems and cognitive problems later on. And they're at a risk for vision problems. So there are a lot of problems that are associated with very early birth. However, with today's medical interventions, we're seeing that babies who are born very, very early are able to fare very well because they're able to get the care that historically they would not have been able to get, and they may not have survived. So again, fewer than half of the infants that are born at the end of that second trimester, especially if they're weighing less than 2 pounds, are going to survive on their own. And this is true even with the most intense medical treatment. But if you were to go back, say, 30 years ago, you would not have found that that we would have such a high survival rate at 24 weeks. So with the more and more medical interventions, then we see a greater or a higher rate of survival. And you see here that birth weight is an important factor contributing to survival. And we'll be looking at birth weight here in a little bit more detail in just a few moments. So there are many different prenatal influences on development, and I want to first start out by thinking about some of the positive influences. And one of those positive influences can be having a mother having good nutrition. And so it's very important for mothers to eat well so that that baby can grow and develop and have a healthy birth weight, because we know that low birth weight is associated with many different risk factors that we're going to be looking at here in just a few minutes. And in addition, healthy nutrition is important for overall physical development in the womb and brain development. For example, folic acid is a very important nutrient that mothers need to get. And so the federal government actually recommends that all women who are of childbearing age take a daily B vitamin, folic acid, and that once a woman's pregnant, that they take 800 micrograms of it. So I think it's 400 micrograms at childbearing age and 800 during pregnancy. But it's, if you think about a woman who's at childbearing age, if she were to become pregnant, she may not realize she's pregnant very early on in the pregnancy. And it's important for her to have very good nutrition, including folic acid. very early in pregnancy. And one of the reasons is because folic acid in particular, related to folic acid reduces the risk of neural tube defects like spina bifida, but it needs to be taken early in pregnancy for it to have that specific impact. So let's take a look at teratogens. And teratogens are, these are any environmental agent that can cause damage to the developing embryo or fetus. And the risks that are posed by teratogens are greatest during certain critical periods of development. So for example, teratogens that may damage the arms and the legs, they're most likely to have an effect during the 4 through 8 week of development. And that's because that's when we see that, that's when the beginning of the arms and legs, we see the beginning of the development of those parts of the baby's body. So there are different critical periods, and these critical periods are related to what is developing during that time of prenatal development. So when a mother is exposed to teratogens, and we'll look at some of these, when she's exposed will determine what may be affected. It's important to note that early in pregnancy, this is when the baby is the most vulnerable, and then it's also important to note that more teratogens, higher levels of them, are more dangerous, and then also multiple teratogens can be very dangerous for the developing baby. So let's take a look at some of the very dangerous teratogens. One of them, if you look here on this slide, we have viruses and other diseases. We have radiation, and I have here listed rubella. And so this is a common childhood disease that can actually lead to serious birth defects like heart disease and deafness and intellectual disability if it's contracted during pregnancy. So women exposed to rubella in childhood, they acquire immunity to the disease, but those who don't have immunity need to have been vaccinated. So when they go into their doctor for their first prenatal care visit, the doctor's going to want to know what vaccinations they've had. Also, there are some sexually transmitted infections like HIV, AIDS, syphilis. These can be transmitted from the mother to the child during pregnancy. Smoking is another teratogen, and smoking can have very harmful consequences on the fetus and newborn, and these consequences can include miscarriage, premature birth, low birth weight, and even infant mortality. And the more the mother smokes, remember I said the greater the level of the teratogen, the greater the risk. Well, the more the mother smokes, the greater the risks. And these risks are not just when the baby's born. These risks extend to grade school children whose mothers smoked continuously during pregnancy. Those children show some abnormal brain development, including lower brain volumes and areas of thinning of neural tissue in the cerebral cortex. You learned about the cerebral cortex earlier in the semester. So think about how smoking can affect the developing baby and how important it is for mothers who, if they do smoke, to quit smoking while they're pregnant. And also to not smoke after the birth of their baby, because we know that there are many risks associated with that. So maternal smoking is also linked to an increase in risk of sudden infant death syndrome, lung problems, early childhood asthma, developmental problems like reduced attention span, learning problems, and behavioral problems. So you can see how important it is then for mothers to who, when they know that they're pregnant, to quit smoking. And ideally, if you are of childbearing age and there's any possibility you could become pregnant, you want to make the healthiest choices for yourself and the potential baby that you may become pregnant with. Okay, and another one is alcohol. So let's take a look at alcohol, which can cause fetal alcohol syndrome. Not all women who consume alcohol will have a baby who has fetal alcohol syndrome, but instead may have a baby who has some impact from the consumption of alcohol. So fetal alcohol syndrome is fairly severe, or it is very severe, I should say, and it results from a mother who is consuming a lot of alcohol during pregnancy. And this is the leading cause of intellectual disability, and it's associated with physical features or physical changes in the baby and child, and then also issues with thinking and behavior. And so it's associated with, more specifically, and I'll be showing you here on the next slide, facial deformities like a flattened nose, an underdeveloped upper jaw, widely spaced eyes. And again, although it's more likely to occur with heavy drinking, there is no established safe limit for alcohol use during pregnancy. And it can happen in mothers who drink a small amount of alcohol, just a few ounces a day during the first trimester. So it's certainly not something that a mother should risk. So even just a few ounces of alcohol during a day during the first trimester. But it is more commonly found in babies whose mothers engaged in binge drinking before they knew they were pregnant. Even moderate drinking during pregnancy is associated with lower IQ scores in children. And so the question then becomes, is there a safe level of alcohol use in pregnancy? And, I think that if you look at professional societies and organizations like the American Academy of Pediatrics, they're going to say no, that any alcohol or drug use in pregnancy is potentially harmful. And even if a very, very small amount, let's say that, there's research that suggests a very small amount is not going to harm the baby. And I don't know that there is. From what I've read, you should not consume alcohol while you're pregnant. And again, like I said, the American Academy of Pediatrics says no, you should not. But when you drink, you're reducing your inhibitions. And so you may be more likely to drink and make poor choices, then that could affect the baby. So that's another issue as well. Additional teratogens include drugs like heroin, cocaine, methamphetamine, and then prescription drugs. I think it's important that you are completely open with your doctor, letting your doctor know everything that you are doing. I recognize that some people may be afraid because of consequences, but I think it's important that that mothers are open with their doctor so that the baby's life can be protected and that she can get the help that she needs to get off of those substances. Also, in particular with prescription drugs, if a mother is taking prescription drugs, perhaps she was prescribed one by her dentist, let's say, she needs to let her OBGYN know that she's taking that drug. She also needs, because it may be that the dentist, has prescribed this, and maybe, that drug may interact with something else that her doctor is going to prescribe, or it may be that her OBGYN, because of the field that the OBGYN is in, is aware of some recent literature that suggests that drug might be harmful. It's also important when you're prescribed any medication to talk with your pharmacist. And so drugs are categorized based on the level of potential risk to the baby. So talking with a pharmacist is going to be an important line of defense. And ultimately, parents are the protectors of the unborn baby. And so we have to think about all of, really exploring and being aware of all of the potential consequences of what we're exposed to. These are just some teratogens. There are many others. And so if you look here on this slide, you'll see that there's an image that shows you the physical features of a child who has fetal alcohol syndrome that we just talked about in the last slide. You also can see here a list of the effects of alcohol, and some of these effects are a combination really of both cognitive and behavioral. And also, you can see here that research has found that alcohol is the leading preventable cause of intellectual disability in children in the US. I'd like for you to also take a look at more information in your textbook related to teratogens so that you're knowledgeable about the effect of these on prenatal development. I think one that we hear about often is opiates, and we hear about something called neonatal abstinence syndrome, and I would encourage you to read about this, be aware of it. This is a significant problem in our area where babies are born addicted to drugs, and there are some very significant consequences for this. So, and these are not just immediate consequences, but there can be some longer term consequences for the baby. Something else that's important for us to think about when we think about human development is socioeconomic status. And socioeconomic status includes things like the income level of the parents, also the education level and the occupation. And so when you have a higher level of those things, then you're going to have more resources to provide for your child. In addition, not only will you have potentially more resources, but you may also have greater access to better health care. You may live in a neighborhood where there are better schools. There's less stress in your home. There are many different factors that are related to socioeconomic status that can affect development. For some of you, you may be very aware of the high rates of poverty that we have in the United States. Among all people living in the United States, children are the poorest age group, where 1 in 6 lived in poverty in 2018. I don't have statistics for 2019 or 2020, but in 2018, nearly 1 in 6 lived in poverty, and nearly 11.9 million children. And so this rate of poverty, which is about 16%, is nearly 1.5 times higher than it is for adults who are 18 to 64. And this is the rate of poverty for adults is 11%. So what does it mean to live in poverty? Well, children are considered poor if they live in a family with an annual income that's below the federal poverty line. If you want to know what that is, you can easily do a Google search. It changes from year to year to find out what that is. And of course, the effects of poverty are going to vary from area to area within which you live. If you live in an area that is very, very expensive, then let's imagine that you live in San Francisco and you live in poverty. The effects of poverty are going to be even more dire for you than if you live in an area where the cost of living is lower. Regardless though, poverty, regardless of where you live, has a significant impact on well-being and access to opportunities and access to as quality education and access to food and basic nutrition. There's a big misconception that people who are living in poverty don't work. As a matter of fact, most people who live in poverty do work, and many are working more than one job. They're working 2 jobs. And so then think about the effect of that on children in the home. When a parent is having to work those extra hours to put food on the table or to pay the bills, that child may not have as much supervision. The child may not have, and then you could think about the multiple effects of that. The child is not going to have the same degree of interactions with the parent or amount of interactions. And we know how important parent-child interactions are for language development. The effects can be really almost immeasurable, but there are certainly very specific consequences of living in poverty that we'll be taking a look at. Poverty is something that does not just affect people that we don't know. Probably many of you know someone who is living in poverty. You may live in poverty. You may have family members who do, or you may have lived in poverty in the past. It's certainly something that when you think about it, here we have in a 36-month period, almost 1 out of every 3 Americans lives in poverty at least 2 months. So poverty is a significant problem in our country. And with the coronavirus and high rates of unemployment, it's only more significant than it ever has been. So why should we think about poverty when we think about the study of human development? Well, I'm only going to touch on a few of the explanations, and you can read more about this in your textbook, but I think this is very important for us to think about. But the nutritional status of children during the critical period is of paramount importance for later physical, mental, and social development. We need to think about the consequences of an inadequate diet for the mother who may be living in poverty while she's pregnant. And fortunately, there are government programs that can help mothers like WIC to get the nutrients that they need, but not all mothers are going to have equal access to quality health care. It's not so easy for all mothers to get the care that they need. It may be some time before they're able to get the insurance they need in order to get the care that they need. And then also we need to think about the consequences after a child is born. When a child does not have adequate diet, which we know can happen with poverty, because we know how expensive healthy foods are, this can affect growth and cognition, muscle development, also social development, increased rates of illness, and difficulty in school. So I have a diagram here that can help you to think about the consequences of poverty and the relationship between each of these, between poverty and a multitude of different variables. So first we have the economic stresses like housing instability and lower school quality, poor health care, risky neighborhoods. We also can think about how this can affect child functioning, like their neurocognitive development, how stress can affect the development of the brain, how it also can affect the way that their brain functions. We also can see poorer cognitive growth and educational attainment, poorer health outcomes, and then even as we move into adulthood, poorer adult employment and income levels. And so then also we could think about the economic stressors increasing family stress, which can increase marital difficulty and increase risks of marital depression. And then we could think too about the emotional stressors of poverty, experiencing social isolation and parental stress, increased risk of substance abuse and legal problems, which then can increase family stress. And then we could think about how family stress can affect parenting quality. And so where parents, because of the stress and also because of the perhaps needing to work 2 jobs, there may be less time that parents can spend with their child. There may also be, and the research suggests that there may also be greater punitiveness. There's more of what we call authoritarian parenting. And this may be because of the increased stress levels in the home. Also, there are relational influences, so that can that play a role here. And so the security of attachment, the stressors that that are the stress buffering support, and also parent-child communication. This can be these are mediating factors that can have an impact on the effects of poverty on the child. So you can see here early impacts on cognitive skills and learning skills. And here we have cumulative vocabulary and child's age in months. And this was a study that was done in 1995. It's a very classic study. That's why I bring it up to show you. Here we go. We have the low socioeconomic status, middle socioeconomic status. Things are about the same early on. And then as we move forward in time, what we see is that high socioeconomic status children have a higher rate of vocabulary or a higher level of vocabulary knowledge than those who are of middle and lower SES. Now, this is actually a pretty big deal because then children, when they go into elementary school or into kindergarten and first grade, if they're coming from higher socioeconomic status families, then they have an advantage over those who are lower socioeconomic status families. So we can think about the importance of interventions. And Head Start is one example of an intervention that has attempted to try to bridge those gaps. And there are many things that parents can do to help to bridge those gaps, and certainly reading to children every day, talking to children, talking about as many things as you can, using, when a child asks a question, instead of using 1 or 2 word answers, having longer answers or longer responses. So, when a child says, are we going to go to grandma's house? We might say, you might find yourself saying no. But instead, you want to say no and then explain why, and then let the child talk about that, and then talk back with the child about that. The more conversation that can happen, the greater the vocabulary development. So these are some things that we can do that are just things at home that can serve as an intervention. Newborns are born with reflexes, and these are inborn automatic responses to particular forms of stimulation. And these are important for promoting survival. There are several different reflexes, and I have some listed here for you. One includes the rooting reflex, and this is where a baby will turn its head towards something that touches its cheek. Then we have the sucking reflex, and this is where a baby will suck on objects that are placed in its mouth or by its mouth. And then we have the grasping reflex, where babies will cling to objects placed in its hands. So think about, you put your finger in a baby's hand and you'll If you've ever done this, you'll notice that the baby will grab onto your finger. So this is the grasping reflex. And then we have the Moro reflex. And this is where the baby spreads its arms and then pulls them back when they're startled or they feel like they're falling. Now, babies who are born very early may not have some of these reflexes when babies who are born at full term would. So, for example, a baby who is born before 34 weeks is not going to have the sucking reflex because that baby just hasn't developed that yet. And so when a baby's born that early, they would need assistance with feeding, which can include a feeding tube. And then they may use they may have a speech therapist who works in the hospital. And of course, the speech therapist is not helping the newborn to speak, but they're actually working with the newborn on feeding and on sucking. And so a speech therapist does much more than just promoting speech. So, these are important reflexes that promote survival. And when babies are born, the presence of these reflexes are indicators of health. And again, if babies are born prematurely, we may not see some of these reflexes. And we may find that, like in the case of sucking, that there needs to be intervention in order to help the baby. So now that you've learned about newborn reflexes, let's take a little bit of time to look at the development of the senses of the newborn. So babies are born with all 5 senses: sight, hearing, smell, taste, and touch. And some of these senses are not fully developed. So let's first look at sight. Over the first few months, babies may have uncoordinated eye movements, so they may even appear to be cross-eyed. And babies are born also with an ability to focus only at close range. And so this is about 8 to 10 inches, or the distance between a mother or father's face to the baby in their arms. Babies are able to follow or track an object in the first few weeks of life, and focus improves over the first 2 to 3 years of life to a normal or typical 20/20 vision. So remember what you learned about at the very beginning of this module. You learned that by understanding normal brain development, you learned about how by understanding that can help us then to identify anything that's not typical. Well, the same thing is true with sensory abilities. By understanding what is normal or typical, then we can identify what is not typical so that we can have those interventions that may help that baby or child to develop. So newborns can detect light and dark, but they can't see all colors. And this is why many baby books and infant toys actually have distinct black and white patterns oftentimes. Let's look at hearing. So during pregnancy, many mothers find that the baby may kick or move quite a bit in response to loud noises. And they may also become quiet with soft or soothing music. So hearing is fully developed in newborns, and babies with typical or normal hearing should startle in response to loud sounds. And these babies will pay quiet attention to their mother or father's voice, and they'll briefly stop moving when the sound of a conversational level sound has begun. Now, newborns do seem to prefer higher pitched voices. So in other words, that would be a higher pitched voice would be what you would hear coming typically from the mother or female. And they tend to prefer this over lower sounding voices, male voices. And they can also tune out loud noises after hearing them several times. So newborns, as some of you may know, will actually have their hearing screened while they're still in the hospital. Of course, newborns cannot report what they're able to hear, but through this newborn screening, they're going to be looking at the neurological activity as that baby is hearing different sounds. And they'll be looking for typical responses so that they can identify if anything that is not typical is happening. Another sensory ability that's important for us to think about is smell. And studies have found that newborns have a strong sense of smell. And newborns prefer the smell of their own mother, especially her breast milk. And this is very adaptive if we think about just human beings, human growth and development. And closely related to smell, of course, is taste. And babies prefer sweet taste over sour or bitter taste. And babies also show a strong preference for human milk and breastfeeding. And this is especially true if babies are breastfed first and then offered formula or a bottle. In terms of touch, Babies are comforted by touch, which you're going to be learning about as you look at attachment and how important attachment is. So placing a hand on a baby's tummy or cuddling them close can help them to feel more secure. And wrapping a baby snugly in a blanket or swaddling is another technique that's used to help newborn babies to feel secure. And so parents will sometimes buy swaddling blankets that are designed to make swaddling easier and to promote that sense of security. And this can be helpful in promoting rest and sleep for the baby. Of course, it's important that that parents talk with their doctor about safety related to swaddling, because a baby, it's recommended that parents shouldn't be swaddling their babies if they're older than 2 months or if they're trying to roll over, because this can potentially raise the risk for what's called SIDS, or sudden infant death syndrome, if the swaddled baby rolls onto their stomach and that swaddling blanket becomes loose. So it's important that parents make sure that they give their baby enough room to move in that swaddling blanket so that their hips and legs can develop. Their legs should be able to be bent up, and so that their growth is not constricted. So this is something that parents should learn from their doctors or nurses in the hospitals. And of course, it's also important that parents don't swaddle their baby in warm blankets if the weather is warm, because this can make a baby overheat, and this can be dangerous for the baby. So it's better for parents to use a light blanket if they're wanting to swaddle the baby, to help them to have that sense of security. And then too, when we're thinking about holding and touch, holding a baby for feedings is also important. So instead of having the baby laying down and then feeding them as they're laying down and not connected to you as the parent, it would be it's much better for that baby to be held. And breastfeeding babies actually will automatically, of course, spend several hours a day in their mother's arms. And not all babies are breastfed, but we do know that there are tremendous benefits to breast milk. But there also can be some issues when mothers want to breastfeed. And so for each parent, it's important for the mother to be able to make that decision and to not feel pressured or not made to feel guilty if she's choosing not to breastfeed or if she has trouble breastfeeding. So what have you learned about? Well, you learned about the 3 stages of prenatal development, and you learned about the characteristics of each. You also learned about what's happening during each of these stages, and you learned about something called teratogens and the potential effects that these can have on prenatal development and some of the long-term effects. You also learned about socioeconomic status and how this can potentially play a role in human development. And so you were able to then think about some of the relevance of this to our broader understanding of human development and opportunities that we need to make sure that everyone has equal access to. You also learned about the physical characteristics of newborns. In particular, you learned about reflexes, and you also learned about the sensory capabilities of the newborn. What will you be learning about next? In our next video, you're going to be learning about cognitive development. In other words, how thinking changes throughout the lifespan.